late tonight for sure. I was up late last night. Whoa.
Hi, I'm Jeff Dean.
And I am Miguel Castañares. We're the co-authors of EMSpañol, a system of books for EMS providers to assess Spanish-speaking patients. This video will show you how to navigate EMSpañol, and we answer the most frequently asked questions about its use.
I'm a career paramedic, and Miguel is a career EMTB, firefighter. I don't speak Spanish myself, but when I asked Miguel to teach me, we realized soon that I would not be able to retain enough Spanish to treat patients in life-death emergencies. Miguel was able to teach me how to sound Spanish when reading, so we compiled a complete, well-organized assessment and translated it using the easiest Spanish possible.
EMSpañol was created by medics for medics. We assume the user will speak no Spanish and the patient will speak no English, requiring our phrases to be easy to say, easy for the patient to understand, even if mispronounced, written to elicit as many non-verbal or yes-no responses as possible, consistent throughout the book, designed to elicit a thorough medical history, consistent with EMS protocols and accepted practice, understandable by different Spanish dialects.
Throughout the book, we solved each problem in the simplest way possible first. For example, names are difficult, so we first ask for an identification card. If the patient does not have one, we tell him or her to speak slowly and state the name. If the name is too hard to understand, we ask the patient to write it down. If the patient cannot write, we have a spelling chart for the patient to point at or say the letters of the name.
Instead of a table of contents, each trimming grouping is tabbed around the outside border for easier navigation with gloved hands. The very first page is Immediate Life Threats, assess airway, breathing, and circulation emergencies, and instructs trauma patients to remain still.
Non-critical calls begin with the patient contact and chief complaint groupings. The provider uses a series of simple questions to identify the patient, collect a history, and determine the patient's mechanism of injury or nature of illness. Each treatment grouping has 2 pages of questions, with the most important or common questions first, top left, and the least common or important questions last, bottom right. Subheadings help locate questions quickly.
A label diagram of the body is on the back cover. EMSpañol Pocket Edition is abridged to allow for readable print in a smaller book, and is designed to survive from the patient's eye back to EMSpañol Ambulance Edition. EMSpañol features laminated covers and coated pages for durability, durable spiral binding, allowing the Ambulance Edition to lay flat or fold over, a method for completing a valid refusal of care form. Official bilingual versions of STAR and Jumpstart trauma triage protocols. The Rapid Trauma Assessment, Fibrinolytic Checklist, and Cincinnati Stroke Scale.
EMS leaders know the importance of a thorough and accurate refusal of care form in reducing liability. Few areas of EMS can get a system or provider sued faster than failing to transport or care for a patient who later claims to have been injured. A refusal of care form offers legal protection by showing that the patient voluntarily declined care. However, when the patient doesn't speak or read English, having him or her sign an English refusal of care form is no more protection than a signature on a blank piece of paper. Using the EMSpañol system to complete a refusal of care form allows a provider to easily confirm the patient is truly uninjured or not sick, is oriented enough to sign a refusal, has not taken pain-masking agents, is not pregnant and does not have other comorbid factors, and is old enough to sign a refusal. Miguel and I thank you for using EMSpañol. For answers to frequently asked questions, testimonials from the field, and other information, please visit EMSpañol.com. Thank you.
Thank you.
I was up late last night. Whoa. And I'll be up late tonight for sure.